Samoro nyalo dhi to suptal to kiyud pesa. Yadhno samoro nitiere, ondikni godo. Chuno ni dhi kawe oko, samoro ionge pesa. Koro pesa momiyo ok wayud kata thiedhruok maber.
Formerly known as Port Florence, Kisumu City is the third largest city in Kenya. It gained its name from the word sumo, which means a place of barter trade, since different communities converged at the tip of Lake Victoria to exchange products such as fish, grain, and so much more. In Kisumu, climate-sensitive health risks such as waterborne diseases, heat-related illnesses, vector-borne and infectious diseases present a daunting challenge to its health sector. Notwithstanding the fact that devolution sought to ensure counties devised innovative models to address their unique health issues, the health sector is still overcast by monumental challenges.
As we realize that healthcare is a very expensive affair, and that no single person, not even a government, can be able to deliver all the healthcare that is required. And so it calls for partnerships with not only the private sector, but all sectors, the non-governmental organization, governmental organizations, and all other people who are interested or stakeholders in health.
Poverty also makes families prioritize providing food over seeking medical care.
An chiliel, to an gi chanayem, to nadhi suptal Russia, to abi kasedhi, to ginyisa ne gidwaro siling 1,000, nan gi leke gariyo mane rama. Koro wi siling 1,000 ni naonge godo kaka an chiliel. Nikech ka wuok eka nyithindo chiem.
Through the partnership between M-Pesa Foundation, Zuri Health, Lions Site, Checkups Med and the Kisumu County Government, this camp sought to address the existing health disparities.
Today we are having a medical camp with partnership with M-Pesa Foundation for the people of Kisumu. It's a special medical camp for us because it talks to what we value as a county. And you know, Kisumu values primary health care, promotive and preventive health care, and that is what this camp is doing.
This is actually our 6th medical camp. We have done it in Lamu, we've done it in Nairobi, we've done it in Machakos, we've done it in Kakamega, Narok, and today we are in Kisumu. So we are here today targeting a minimum of 3,000 beneficiaries, and we are looking at supporting the beneficiaries with the general ailments. We are also looking at specific and specialized cases like non-communicable diseases. We will also be screening for fistula. We are screening for cancer. We have dental services. We've also partnered with Lions Site First to take care of the eye element of the camp.
The camp leveraged technology to collect patient information and increase efficiency in service delivery.
The registration with our phones, or how we are doing it digitally, has mostly helped because it is easier to track someone from their entry to their exit point. When someone comes in, you have their name, you have their age, the number of children they have, what they do in their life. So we get to understand them better at the registration. We send them to triage to get everything else done. From triage, they'll just take the number that we have assigned to someone after we have gotten all the information, of course with their consent. They get to track it at triage, get their name there, get to see how their lifestyle is like, and then continue treating them from there on. Even from triage, the same information will be accessed by the doctor to see the vitals that they have gotten from triage. So it is more efficient to do it this way than having someone write it down and have to take it to a doctor to doctor. Even the pharmacy, they just key the number that we've given from entrance, and then they can allocate the medication given from the consultation and doctor services.
Although mortality rate from infectious diseases in Kisumu County is high, there is a shift towards higher mortality from non-communicable diseases such as diabetes, cancer, and cardiovascular diseases.
Like all other parts of the country, diabetes and hypertension are the key chronic illnesses, but Kisumu also has other chronic illnesses, as we know, sickle cell anemia, and of course HIV is highly prevalent in this area. So over the last few years, the last 3-4 years, once we've spruced up and improved our community health, we have seen that the number of diabetes and hypertension clients have gone up 5-fold. We know that if you look at the causes of death, for example, in Kisumu, stroke right now is the third largest cause of death. And stroke means that you have diabetes and hypertension in the community, which is not being identified early and being treated early, and therefore leading to high cases of stroke.
This epidemiological transition in Kisumu prompted the camp to focus on addressing the non-communicable disease burden, whose mortality rate stood at 48%.
So with this kind of partnerships and with this kind of activities, we can identify diabetes and hypertensives early, treat them so that we reduce the complications that arise from these chronic illnesses.
The prevalence rate of hypertension stood at 27%, diabetes 3%, osteoarthritis at 6%, and respiratory tract infections at 16%.
From the random blood sugar, we've been able to get like really high values in the blood sugar tests. So in such scenario, we are sending the patient to the non-communicable disease tent, where they are being seen by specialists. And if a specialist sees the need to send them maybe for further medication, we are requesting for an ambulance. And we've had like 4 cases. At least they've been able to get the help in the county government hospital. For the urinalysis, we are using our bus. So we have like 3 people there, where we have a urine analyzer. And since I've been supervising the area, I've been able to see like a probability of urinary tract infection. So at least with that, the doctors can make a diagnosis, and they are going to the pharmacy to get the medication.
Kisumu is an endemic zone for malaria due to its close proximity to Lake Victoria Basin. According to WHO, the Lake Endemic Zone has the highest malaria prevalence among children aged 6 months to 14 years. Considering this, malaria tests were conducted with the provision of anti-malarial drugs to children who were found positive.
An kuru kano chako rama to orama bangi gini ariyo to kuru ochopo kama kuru aneno mana bu iro kuru kanyan pogo ji ariyo kuru ji riwore na kuru nutera kosetimore na kamano kuru nutera sabati mondo dhi ong'ina kuru kano ong'ina to noyangi kuru nyaka sechegi kudu okadwa nane chieng kata nane iro okadwa nane buto.
Globally, over 2 billion people have a vision impairment. 1 billion of these cases could have been prevented or are yet to be treated. In low and medium income communities, the lack of eye clinics, equipment, eye care professionals, and funds make access to eye care services a distant reality.
Donge samoro ng'ato onge pesa to otuo. Koro onge pesa monyalo dhi gi thieth mondo mi owachne ni tuo tidwaro pesa to koro pesa onge. Koro chune ni ok onyal dhi. Nikech gimotimore nani ok nang'e ni anyalo yude nade. But pesa mithiedho go wang' en pesa maduong' makata en mana 24,000 eka mondo yang' wenge nigi.
In Kenya, over 80% of people who need reading glasses do not have them. Nonetheless, uncorrected refractive error remains a major cause of visual impairment with a prevalence rate of 62%. Partnering with Lion Sight First Eye Hospital ensured that Kisumu County residents receive eye screening services that they desperately need.
Koro aneno mana ni gikonya nikech an be naonge gi ng'ama nyalo konya. Pod gikonya kata ncho be noseyanga to pod nawinjo thieth lit to ago erokamano ni gikonya nikech aonge gi ng'at manyalo konya nikech aonge gi nyithindo yoyote. But an mana gi nyikwayo kende mango. To nyithindo manonyuolo nyikwayo gi nosetho te. Koro an mana gi nyikwayo kende mamoko jo secondary. Moko jo dhi timo klas 8 higani. Moko bende nie 4. Koro ka ok anyal neno to onge kaka ginyalo chiemo, onge kaka anyalo wuotho mondo mi ayudnegi chiemo kata sabun kata gimoro amora ma dhano konyorego. Onge kaka ginyalo yudo ka wang'a ni ok nyal neno. Koro mane manochuna mondo mi abi ka nikech pod awinjo rem.
Over 700 patients were screened with provision of reading glasses. 365 patients were diagnosed with allergic conjunctivitis and 41 patients scheduled for cataract surgery. Essential medications for eye conditions were also provided. Dental health is a crucial aspect of overall well-being. It involves maintaining the health and hygiene of your teeth and gums to prevent oral issues such as cavities, gum disease, and bad breath. In the Kisumu Health Camp, dental health services ranging from minor dental extractions to oral hygiene education were provided.
Kawuono taneno ber nikech athiedhora kendo yath sani an godo to jorasha kanabi to nok gimiya kata yath. Nabi kendo asetieko dweche 2 kapok atimora nade kala kapod rama. Kawuono aneno ber kawuono golna lakaga yedhe bomiya nono. Koro agoero kamano kabisa.
A record 93% of patients screened received minor dental extractions and 20 patients referred for fillings at the county referral hospital. It is estimated that 1 million women worldwide live with untreated fistula, a devastating injury primarily caused by prolonged obstructed labor when women do not have access to timely emergency obstetric care. Although many strategies and policies have been instituted to reduce maternal mortality and morbidity in Kenya, access to fistula treatment remains a challenge. It was important for the camp to put keen focus on addressing the fistula threat in order to restore women's dignity.
As part of our health initiative, we aim at ensuring that we create demand for mothers to give birth in hospitals. Because if they don't give birth in hospitals, there are so many challenges that may occur, one of them being the fistula. So, and that is why even within the medical camp today, we've ensured that we are screening for fistula. Once they are screened here, we will ensure that they go to our next fistula camp where they can be able to get this surgery for free.
Recently, the worsening economy, high unemployment, and the continued escalation of healthcare costs have created or worsened financial burdens for many.
Chandruok to waneno mang'eny kidhi Russia kata general idwaro pesa. Samoro be kidhi ni yath onge. Koro koso pesa omiyo Nyasaye ochano mawabiro ka.
For some, unfortunate circumstances have pushed them to the wall, impairing their access to healthcare.
But an mana gi nyikwayo kende mango to nyithindo manonyuolo nyikwayo gi nosetho te an ema manyonegi gionge wuongi an ba onge jaoda an alone kama.
During the health camp, patients suffering from chronic illnesses received a 1-year NHIF cover to cushion them against the skyrocketing medical costs and enable them manage their conditions effectively.
Something else that we've added onto the medical camp is the NHIF, because we found out that there's so many people who are not able to go to hospitals because of lack of finances. So we are identifying 10 beneficiaries who have chronic diseases and enrolling them on NHIF.
This is a type of family planning that goes for 5 years. If you see very well, it has 2 roads. That's what makes it to be called Judea.
Sexual and reproductive health services is one of the camp's areas of focus. Despite efforts made to increase access to contraceptives, the need for modern methods of contraception is largely unmet. The health camps play a significant role in improving access to comprehensive reproductive healthcare services in Kenya to empower women and couples to make informed decisions regarding family planning, thereby ensuring safe childbirth, birth of healthy children, and improving economic status.
We are one of the countries which have high number of adolescent pregnancies, and in partnership with Safaricom, we are building up one of our medical facilities, one of our dispensaries, for it to be able to offer reproductive health services, what we are calling a mother and baby unit, somewhere in Seme, to be able to partner with them to be able to offer medical services for adolescents who are coming into that place. That area has a high number of adolescents who are getting pregnant, who need this kind of services, so that they are given family planning services. For those ones who get pregnant and they get babies, they're able to be taken care of in a place that respects their care and respects them, and they're able to be returned back to the community to be able to go back with their school.
Free medical camps are extremely helpful to low-income populations who cannot afford expensive healthcare services. However, health camp benefits often disappear when the patients return home.
There is use of telemedicine, which M-Pesa Foundation has partnered with Zuri Health to be able to offer this care continuously and to follow up the patients who are coming in. This is very important for us as a people of Kisumu, because we are aware that if we are going to offer medical care in a medical camp, many times it is a one-off process, but this actually is a journey. It's a journey of identifying people who are at risk, treating those ones who can be treated as emergencies, but also ensuring that those ones who have chronic illnesses or need follow-up are continuously followed up for a longer period of time as is required.
Agitimo maber, gikonyo ji ne nigi shida mopogore opogore. Kas thieth bodhi piyo piyo. Ok aneno koko moro kata dondruok, ji odhi sawa.
Chenro ma gitimo ni ber, to ma yudo aina ni tek. Gimed chiwe, gimed kele. Aparo ni ngima mang'eny gikonyo kawuono kod kinde ma chien kono gi gik ma gitimoga. But ahinya korka thieth koni to gikonyo ngima mang'eny. Koro amedo kwaya ni gimed timo mae. Kik obed mokwongo to kik obed mogik.
We are grateful as Kisumu County for the partnership we are having with them, because it talks actually to what we stand for. We are very high on digital technology, and we believe that digital technology, leveraging on digital technology, can make work efficient and follow-up of people better. So we thank the M-Pesa Foundation for having chosen Kisumu to have this camp today, and for all the work that we are doing together with them to improve the life of the people in Kisumu.